welcome to the final episode of the India Health Mission on Times Network, presented by Darwin Group, powered by Bacto V, associate sponsor Herbalife Nutrition and Newberg Diagnostics. Now, India's corona count is rising fast. We have already crossed the 5 lakh mark. Yes, there are 5,08,953 cases in India, with over 18,000 cases reported in just one day. 8 states are responsible for over 85% of the caseload and 87% of COVID-related deaths in India. More and more tests are being conducted now, over 2 lakh per day, but our positivity rate is under control, which is a big positive. Another encouraging sign is rising number of those who have managed to defeat coronavirus. Recovery rate is over 58%. Close to 3 lakh people have already recovered, and mortality rate is one of the lowest in the world. Over the last 2 weeks, India has seen a surge in fresh cases, coinciding with the unlock phase 1. Delhi's COVID count has surpassed Mumbai, and the national capital has emerged as a new hotspot. It is worrying, but interestingly, Centre and the Delhi government are working together to deal with this crisis in Delhi, and we are seeing results as well. More and more beds are being added. There is a plan now for house-to-house survey to identify suspected cases, and there is a timeline that the government is working with, which is very encouraging. Government is taking steps to defeat COVID-19. And in this episode of the Living Room Conclave, we are going to discuss what role can the private sector play in aiding the government in this fight. We have with us Venkatesh Vijayaraghavan, CEO Cabin Care, Ajay Harinath, Chairman Darwin Group, Dr. GSK Velu, Chairman and MD Newberg Diagnostics, and also let's welcome India's Health Minister, Dr. Harsh Vardhan, joining us live right now, along with our Group Editor Politics, Navika Kumar. Over to you, Navika.
Thank you very much for speaking to Times Now, Dr. Harsh Vardhan. What's your assessment of where India stands today vis-a-vis our fight against COVID-19?
In a fight against the biggest unknown ever, I think we have fared well. On a 0 to 10 scale, I would rate India at an above of 7. We actively preempted and not just prevented. That has been the gist of how we fought this war. And the world has been lauding us for our best practices. I think your audience is aware of where we stand and how bravely our government has fought on the ground. In a vast and diverse country like India, we have done exceedingly well. It was an extraordinary situation, and the world was unprepared. However, Government of India responded by front-loading tough measures. The extraordinary decisions of the last 6 months, from clamping down on air travel to the national Janta curfew, on to initiating countrywide lockdowns, to bringing back lakhs of Indians stranded abroad. All these decisions stand out largely because no other big country affected by the virus took such drastic steps in anticipation of community transmission. Many scientists predicted doomsday for India, quoting our humongous population of 1.35 billion, as well as our many limitations. But we have proved them all as miserably incorrect. We have overcome all the difficulties and set an example for the whole world. You have also asked me, where do we stand today?
That's right.
Well, we have many more challenges ahead of us as the numbers rise, as we evolve strategies. Medicines are under trial and vaccines are underway. The virus has changed all our bearings. It has changed the way we govern and the way we respond to exigencies. And I would say that we have learned well. No political leadership or policy maker is certain of what lies ahead. We are in an extremely critical phase even now, but we are far more confident and better placed compared to the rest of the world. We have done well, and our biggest advantage is the political will we have. With a Prime Minister as dedicated as Narendra Modi ji, leading and guiding us from the front.
That's right. But Dr. Harshvardhan, India has today more recoveries than active cases right now. But what are the points of concern in your view? We are still adding more than 14,000 cases a day. Is that not representative of some sort of a community transfer?
You have said it well. Our recoveries exceed our active cases. Our recovery rate is more than 56%. And our mortality rate is amongst the lowest in the world at about 3.18%. Our 42% active cases are also on road to recovery. So we are optimistic that our containment and mitigation strategies have paid off and shall continue to do so. In the pre-lockdown period, our doubling rate was just about 3 days, and the same is now more than 19 days. Our cluster containment strategy has focused on early detection of cases and containing the disease within a defined geographic area by early detection, breaking the chain of transmission and thus preventing its spread. The addition in positive cases that you are talking about is because of the aggressive testing strategies that we have recently effected. The testing protocol has been systematically tweaked to ensure that we catch the infection at a very early stage and prevent further infections. The net rise in number of positive cases has also stabilized. Look at the national figure. It stays more or less the same because in some states we have gone up and in others we are consistently going down. Therefore, the increase in positive cases has also reached a plateau. Situation will be like this for some more time before the epi curve starts to go down.
So you're saying it will still take some time. The kind of conditions that we are seeing in Delhi and Mumbai and all of Maharashtra and Gujarat and several other states, how far do you think India is from its peak?
I don't see any peak. If you carefully see the situation across the country, there is a steep increase in the number of reported cases due to aggressive measures launched more recently by the government to trace, track and test and of course treat. This increase is going to be more or less stable and at the same level if you take the country's cumulative figure also. As I have just explained, in some states it may be higher and in some states it may even be going down. So the net daily increase will be at a particular level. So that's not called peaking. It's different from the traditional sense of peaking and the definition of peaking. You see, a new potent virus has come into the world and we are fighting it very, very aggressively. It will take some time to disappear. On our part, we are not leaving any stones unturned. Our mortality is much lesser as compared to the rest of the world. Our growth is not exponential. It never was. Already treatment has begun. Convalescent plasma therapy and some new drugs are in the market. These are also leading to confidence building amongst the public. My personal calculation is that we may have to fight this disease aggressively for another 2 to 3 months only.
Dr. Harshvardhan, I mean, what you're saying sounds like music to my ears if this is actually going to be a challenge only for the next 2 or 3 months. But let me also ask you, Mr. Health Minister, we have conducted more than 6.4 million tests thus far. Should we ramp up our testing even further? Because many people say that if you test, there will be several others who will turn out to be positive because many people are asymptomatic and not showing those symptoms as of now.
We are actively following 4 T's: tracing, tracking, testing, and treating. Testing is an important pillar here that helps us in confirming the disease. We have come a long way in adding capacity as far as testing goes. In January 2020, there was just one lab in India for COVID-19 testing. As of today, this has been increased to 992 labs. This includes both government as well as private labs. The testing capacity is being scaled up rapidly as per the requirement. In fact, within the last 2 weeks, we have increased our capacity by 56%. And our current testing capacity is at 2.5 lakh samples per day. As I said, the testing protocols are continuously being tweaked, depending on the response as well as the evolving strategies. As and when it may be required, we have the capability of increasing our testing capacity.
You know, Dr. Harshvardhan, I want to ask you, how do we stand on the medical infrastructure front? Does the country today, as per your assessment, do we have enough beds available, especially ICU beds? Because already we're seeing in many cities that hospital infrastructure is virtually bursting at its seams. Whether it's Delhi or Mumbai, that is the big worry normal common people have.
We have done tremendous scaling up of our medical infrastructure in the last 6 months. We have much more than our present requirement. For instance, as of today, only 2.5% of the total number of active cases are in the ICU. Only 0.5% require ventilatory support, and only 2.8% require oxygen. So we have more than enough infrastructure. However, in anticipation of any sharp increase that may occur in COVID cases in the future, we are continuously scaling up our infrastructure. For example, we shall add 60,000 additional ventilators by the end of this month, which will lead to more than doubling our present capacity of ventilators. With about 1,000 dedicated COVID hospitals, around 2,300 dedicated COVID health centers, and around 9,000 COVID care centers, the total number of dedicated facilities adds up to a good more than 12,000. The total number of ICU beds dedicated for COVID are 33.5 thousand. Oxygen therapy supported beds are around 1.25 lakhs. So, total beds available for COVID patients is around 13 lakhs, which includes COVID hospitals, COVID health centers, and COVID care centers. Despite all this, we are still increasing our capacities every day. Be rest assured that there is going to be no shortage of infrastructure in any eventuality.
Well, at a country level, at a national level, we may on paper have enough infrastructure, but will it be enough in every city, for that city? That's the question, because in between we did hear many states saying that you have to cure your people and admit your people in your own state, and people from outside will not be allowed in, and then those policies were changed, and that creates a little bit of panic amongst people. But let me also ask you, Dr. Harshvardhan, I want to ask you that we've gone through lockdown, we're still going through several measures of containing ourselves, staying indoors, working from home, all of these new rules that have come in with Corona. How soon do you think this country and people in this country are going to come back to what we used to call normalcy? Also, do we have to learn to live with COVID-19 for a long period of time, or are we going to see an end to the spread sometime in the near future?
Lockdown was a major containment strategy, and it helped like nothing else could have helped at the time when coronavirus struck the whole world. With lockdown, we got the time to prepare and enhance our health infrastructure, train lakhs of frontline personnel, and also contain the spread of this deadly disease. All studies show that although lockdown is a painful option, it yields good results. Without any lockdown or social distancing measures, we would have reached peak mortality in approximately 3 months. But because India succeeded in a near perfect lockdown, we didn't come to the peak at all. In fact, we escaped the peak. In a country as vast and varied as India, lockdown was a difficult experiment. But with the far-sightedness and persistence of Modi ji, it succeeded. So much so that the whole world is today talking about how valiantly India fought the coronavirus, and citing that the lockdown went a long way in slowing down the growth of the epic curve. We are now opening up in a phased manner. The strategy is to let people gradually return to normalcy while maintaining a fine balance between returning to normal and containing and mitigating the virus. We call it an exit strategy to help people out of the financial difficulties that the lockdown created. Our Prime Minister announced a massive stimulus package to get the economy back on track. We are gradually lifting all the restrictions, and yet an element of pain remains. But the people of Bharat are very resilient. We will rise like a phoenix from this situation too. The third part of your question was, are we going to have to learn to live with the virus? Well, yes. We have already learned to live with the virus, haven't we?
Yeah.
Remember where we were in January and where we are now. The journey has been one of learning. Just 2 days ago, I was addressing the Economic Times Summit virtually about how governance has changed in the post-COVID world.
That's true.
And I said that the pandemic shall definitely leave an imprint on both governance as well as polity. Thanks to this virus, we have learned many lessons in governance. Timely response to any crisis, and a high level of preparedness to go hand in hand with it. We have learned more effective public communication in times of this crisis. We have already learned how to live with this kind of an exigency. How much should we share with the public so that their morale doesn't go down? How to maintain this fine balance in public communication in such times? We have learned some very important and painful lessons. The virus has taught us all to stand together and as a government how to take an all-inclusive community approach. This crisis proved to be a test. I think we cleared the test. It taught us many things and presented many unexplored opportunities. The virus has changed everything, and the change is here to stay. In other words, when we live with the change, we learn to live with the virus and what people have started calling as the new normal.
Well, I know it's a new normal. We've all learned new things and how to handle our lives with all, all the side restrictions that have been put on us. But let me ask you, Dr. Harshvardhan, as Health Minister, has this been your biggest challenge yet? In fact, in any role that you've played in the past, you've held many portfolios. Has this been the most challenging phase of your life?
In my lifetime, yes. Definitely this has been the biggest challenge for me. Bigger than the challenge that I faced when I was working to defeat the polio virus. If you get a chance, do read my book, A Tale of Two Drops, where I talk about challenges which looked unsurmountable to me at that juncture. But as nature has it, mankind has been created to face challenges and win over them. India succeeded. Polio was eradicated from the country. Now, look at the corona challenge that has come. A virus so potent that it has impacted about 9 million people and destroyed almost 500,000 lives. It is the biggest challenge as the health minister that I could have faced. Look at the vastness of our country, the health infrastructure that needed to be enhanced at jet speed, and the facilities we had in general. There were areas and pockets where 80% of the population depends on community toilets. About 8 to 10 people live in households which measure about 10 feet by 10 feet. Coupled with existence of narrow lanes with 2-3 storied houses where often the ground floor is a house and other floors are used as factories. These became our hotspots. Hence, there were severe limitations of physical distancing with no possibility of effective home quarantine. It was all so complex. We responded. We crafted out strategies after strategies with individual states depending on their respective conditions. I can only say that big challenges bring big rewards. The reward of cases going down, mortality going down can be termed as some kind of satisfaction. But I shall not rest until the virus stops killing our people. That's the challenge. Bigger the challenge, bigger the opportunity for growth, and bigger the satisfaction.
Well, yes, it's been a huge challenge. But I also want to ask you, Dr. Harshvardhan, the medical fraternity, right from the ASHA workers to ward boys to the doctors and nurses, they're all leading this battle from the front line. What's your message to them at a time when this challenge seems to be at a peak? You say there's going to be no peak, but it's moving towards a peak because the number of cases are going on increasing.
My message to them is, सरफरोशी की तमन्ना अब हमारे दिल में है, देखना है जोर कितना बाजुए कातिल में है. The corona warriors are making immense sacrifices to defeat the enemy virus and save the nation. I am quoting this song from my school days. When we learnt about the immense sacrifices that our thousands of young warriors made to achieve independence, my corona warriors are no less than the young freedom fighters of the Indian independence movement. To be honest, sometimes I feel very pulled down in this war. When I hear of my corona warriors succumbing to the disease and that they are ill and their families are suffering, their sacrifice cannot be quantified. And as their captain, I want to walk each step with them. I want to share their problems in the cause of the nation that is supreme. I call upon them to continue in all earnestness as they are doing at present. For them to continue tirelessly, I call upon the nation to come forward and support them with love and respect, with words of encouragement
Hasn't happened all the time.
and support for their families. Our government is doing its best to support all our corona warriors at this juncture. I seek your cooperation from the media to spread this message of love and respect for the corona warriors.
Dr. Harshvardhan, India Health Mission is a Times Network initiative to focus on prevention and immunity along with the COVID crisis, since that is the only long-term solution. Your response to this initiative, because how can people build their immunity and fight this? That has to be our response system.
I laud this initiative from the Times Network group. It's indeed appropriate for you to run public action campaigns on what's right and what's wrong, the do's and don'ts, including prevention and immunity. I may also suggest that you take up some more such initiatives in the larger national interest. These could include helping to shun the stigma against COVID patients, then televising stories of success to lift the morale of our corona warriors, then maintaining continuous flow of information on precautions and government guidelines, and spreading only factually correct information. By doing this, you would have lived up to your responsibility of being one of the 4 important pillars of society. Relay real-life stories of how the corona warriors are fighting this extremely difficult battle. Show stories of their sacrifice to remove the stigma from the minds of some people who have not realized the worth of our doctors, nurses, paramedics, sanitation staff, policemen, army, journalists, and airport personnel. Tell our corona warriors that the entire nation is with them.
Absolutely. We stand in solidarity with all our corona warriors, and as you have stated, Dr. Harshvardhan, we've done a lot of stories on the corona warriors who've come out absolutely safe and sound. These are stories of hope. These are stories of perseverance, and we will continue to do this. Everything that we can do to arm our citizens to face this challenge will be done, and we at Times Network are doing that. But I also want to ask you, the government has waged a very informative and comprehensive awareness campaign. How can we combine the best of both traditional and modern means, Dr. Harshvardhan ji, to build immunity? Because that is what it boils down to, because many people feel that they could get the infection again. How do we combine home remedies, something old-fashioned, our nani dadi's remedies, along with modern medicines?
I support innovations including drug discoveries, repurposing of drugs, traditional medicines, and developing new therapies in the search for potential treatments for COVID-19. India has always done well in rediscovering age-old traditional medicines through Ayurveda that can actually build up immunity and prevent absolutely any disease, because nothing can strike a healthy body which has good immunity. We already know the benefits of yoga too, and we have taught the world to do yoga. Indian tradition is to build the body and build up the immune system. Yoga too goes a long way in building immunity. WHO too recognizes that traditional, complementary and alternative medicines have many benefits, and India has a long history of traditional medicine and practitioners that play an important role in providing care to the population. Many medicinal plants are being considered as possible treatments for COVID-19 and are being tested scientifically for efficacy as well as side effects. That is handled by another ministry called Ayush.
Well, Dr. Harshvardhan, we really appreciate your time. We appreciate your participation in this India Health Mission, because we're looking at moving forward. We're looking at spreading the message. We are also wanting to look at spreading information and precautions on how people can prevent this from happening and keeping their morale up when COVID actually strikes. And of course, a big salute to all our corona warriors. Thank you very much, Dr. Harshvardhan, for joining me on the India Health Mission. We'll slip into a short break. Keep watching Times.
Welcome back. You're watching India Health Mission on Times Network. We have with us right now Venkatesh Vijayaraghavan, CEO Kavin Care, Ajay Harinath Singh, who is Chairman Darwin Platform Group of Companies, and also Dr. GSK Velu, Chairman and MD Newberg Diagnostics. Let me begin this discussion with you, Mr. Venkatesh. Now, we just heard the Health Minister of our country say that coronavirus has changed the way of life, and I'm sure for business houses as well, the approach towards business and what they make has also changed. As far as Kavin Care is concerned, we know it is a Chennai-based company and a pioneer in Indian sachet revolution. How has COVID really changed the FMCG sector and its approach towards business?
Yeah, like the minister had mentioned, life is taking a new normal. And I think when you talk about life and business, the new normal is across multiple facets of life. One area that I could definitely say is the way you look at business, the constraints that have come up. Equally, there are a lot of learnings that we've picked up. One area definitely has been the way we've been able to manage employees working from home. In periods when social distancing is required, you're not able to go out of houses. We've still managed to run businesses with employees working from their home comfortably. Challenges, but yet we've been able to work that out. That's a new normal, and I think that's a new normal from the industry perspective. The other normal that you would probably see is, despite the constraints that the industry has had in terms of the factories, in terms of people being able to reach out, I think the industry at large has been able to supply to the demand of essentials that is happening across the country. Now, that's again a new normal that's happening. So across businesses, across aspects of business, we're definitely seeing a lot of new normals that are defining probably the way in which we would probably look at future as well, be it in terms of deployment of resources, be it in terms of utilization of resources, be it in terms of working styles, be it in terms of the new norms of social distancing. I think a lot of new inputs is something that we are looking at. And therefore, I believe that the new normal is here to stay.
Okay, and we have to slip into another very, very short break. But when we return, we'll discuss how private sector is helping the government in this fight against coronavirus and what more can they really offer at this point in time. Stay with us. Welcome back. Here with us on Times Now, and this is India Health Mission on Times Network. We have with us Ajay Harinath Singh, who is chairman Darwin Platform Group of Companies. And as we've been discussing so far, that how this crisis has to be seen as an opportunity, something that Prime Minister Modi has also been talking about. We know that Darwin Platform Group of Companies also launched quick COVID test kits. Could you tell us more about it? At what stage is it right now, and what are the plans ahead?
Well, the plans ahead are we are going into manufacturing mode, and Darwin Platform Group of Companies is actually with the pharma division. We are actually going ahead with the manufacturing mode of the COVID test kit with the help of the Canadian partners. Neil Milani is the partner of ours who's taking care of it right now. We are also into social work also. We are doing a lot of sanitization work. We are also taking care of the villages, the rural areas, where we are taking care of people, giving them information how to prevent themselves from this kind of pandemic and endemic which is happening in the sector right now.
Okay, and on the issue of philanthropy, what kind of an opportunity do you think this crisis has brought?
Philanthropy, it's a social work. I mean, depending upon the scope of work which we are doing it right now, we have not catered much of the organizational views, and we have not gone ahead more than what people have been expecting us to be doing it, because as we look into the matter, like philanthropy involves a lot of donation, a lot of CSR activities, government reforms, and we are looking also for government to help us in more of the prospects where we can go ahead and do much more better and better for the people in the Indian sector. We are trying to make people aware as much as we can by sanitization, giving them masks, kits, with the cops, with the police department, the health sectors, health departments, asking the doctors to come back to work, and also helping out the people. Yes.
Okay.
So we are trying to do as much as we can from our end. And
stay on with us. In fact, we have to slip into another very, very short break. We'll be back with more on this on the other side. Welcome back. You're here with us on India Health Mission on Times Network. We are joined by Dr. GSK Velu, who is Chairman and MD, Newberg Diagnostics. Dr. Velu, now there are about 1,026 diagnostic labs dedicated for COVID tests, which includes 285 in the private sector. How much more can private sector really help in terms of increasing the number of labs, and what are the challenges?
I think you know this, as Health Minister was saying, we are in a war here, and we cannot be winning this war only by public sector alone fighting this. We need the private sector to join together to fight this, and as you yourself were saying in the show, testing is one of the important criteria. So from almost nothing, couple of months back, we have close to 300 private labs. I'm sure we can further increase it to more than 600, 700 private labs can be brought across the country to scale up the testing. Even in our own group, Newberg, we started with 4 labs and we are in the process of adding 4 more labs. So soon 8 to 10 of our labs will be doing COVID testing. And now you know it's not just RT-PCR testing. The government is talking about antibody testing and antigen testing. Once it is used very meticulously, depending on different considerations and different criteria, I think we will be able to help the government. The private sector can really scale up and help the government in the testing strategy.
How is the private sector really responding to this general public's demand on cap on prices for tests?
I think every state has come up. Initially, we all started with 4,500 rupees, and even during that time, like us, some of our labs, we were doing tests free of cost for certain section of population, including people below the poverty line. Currently, every government is talking anywhere between 2,000 rupees to 2,500 rupees. So the prices has come down 50%, mainly because availability of kits have increased, and products, we were importing all the kits just 2-3 months back.
Right.
Today, I think India has excess capacity. Almost all the kits which is required for doing testing can be manufactured, and it is being manufactured currently in India.
Right.
So the prices has come down substantially, at least 50%, and there is a scope for little bit coming down further, so that not only in the RT-PCR testing but also in antigen and antibody testing, so that the private sector will play a very big role in enhancing the testing needs for the country.
All right. Appreciate all of you for joining us on this India Health Mission. Dr. GSK Velu, Mr. Ajay Harinath Singh, and also Mr. Venkatesh Vijay Raghavan. Thank you very much for being a part of this India Health Mission on Times Network, presented by Darwin Group, powered by Bactovi, associate sponsor Herbalife Nutrition, and Newberg Diagnostics. Thanks for watching.